Chapter 5 Vaginal Delivery and Postpartum Care. Recognizing the start of labor and when to come to the birthing center. Labor generally starts spontaneously between 37 to 41 weeks of pregnancy. Around this time, you may pass your mucus plug, which are jelly-like bloody vaginal secretions that may be alarming. But don't worry, this commonly happens before labor begins. However, please note that passing your mucus plug is not always associated with labor. You should wait for other signs of labor before presenting to your healthcare provider. For most women, labor starts with uterine contractions that get progressively stronger and more frequent. If you're experiencing contractions that are irregularly spaced, you may be in early labor. It may be beneficial to stay at home and manage your contractions at home as long as there are no warning signs, including those stated at the end of the Chapter 4 video. Some pain management techniques include walking, taking a warm bath or shower, massaging, or sitting on an exercise ball. If this is your first baby, you should go to the hospital or birthing center if you're having contractions every 5 minutes or less for over 1 hour. If it is not your first delivery and you're experiencing contractions every 5 minutes, you should present to the hospital or birthing center. Sometimes, labor can present as constant vaginal or rectal pressure or regular bouts of lower back pain. If there are any doubts of whether or not you are in active labor, you should contact your healthcare provider or local birthing center to discuss whether you should be evaluated. At the hospital or birthing center, the healthcare provider will examine your cervix to determine if it is open. If you're still in an early phase of labor and your cervix is still closed, your healthcare provider might recommend going back home and returning when your labor is more active or your cervical dilation is equal or more than 4 centimeters. Although you may feel tempted to stay in hospital after you've been evaluated to be in early phase of labor and a baby is in good health, studies have shown that there's increased risk of medical interventions such as oxytocin administration and cesarean sections for slow labor progression for patients who are admitted too early. If you suspect that your membranes have broken and you experienced a gush or trickle of fluid, you might want to place a pad in your underwear and walk around. It may be difficult to distinguish between urine and amniotic fluid at this stage of pregnancy. If the pad fills within 1 to 2 hours of fluid, you will want to present to the hospital or birthing center even if you have no contractions. Once there, healthcare professionals will assess if your water has broken and admit you to the labor and delivery unit. If you start experiencing contractions on your own, your labor will be monitored. If no contractions are present, it may be necessary to induce your labor, especially if you're a carrier of Group B streptococcus or GBS, in order to prevent infection for your newborn. If you are unsure about recognizing the start of labor, do not hesitate to contact your healthcare provider or the obstetrics department of your hospital. Pain management during labor. Different pain management methods are available to women during labor and delivery. These can be divided into pharmaceutical and non-pharmaceutical pain management. Please verify with your healthcare provider what is available at the hospital or birthing center. Walking around, changing positions, and sitting or standing upright are associated with reduced length of the first stage of labor, which begins from the start of labor until a fully dilated cervix. It can also decrease the risk of requiring instruments to help deliver your baby. A birthing companion such as a doula, your partner, or family members for emotional support during labor has also shown to be beneficial for all women in managing pain. Non-pharmacological methods, as listed here, may be available during your labor, and if you're interested, you may discuss these options with your healthcare provider. Epidurals are available in most hospitals upon request. An epidural analgesia is a safe method of pain relief, and a low-dose epidural can allow women to walk. Low-dose epidurals are not available in all hospitals, however. Some opioid medications such as morphine or fentanyl are equally available if you're in an early stage of labor. If you are more advanced in the labor, opioids might not be an appropriate method of pain relief because it may cause your baby to have temporary decreased drive to breathe if given within 4 hours before birth. Local nerve blocks, such as a pudendal nerve block, may be performed by obstetricians during the second stage of labor, when you start pushing, until the birth of the newborn. Pudendal nerve blocks can help to relieve the pain and pressure as the baby is coming through the birth canal. This nerve block doesn't usually help in the first stage of labor and may also not always work for the second stage of labor. Usually, if you have an epidural, it is enough to cover the pain such that you don't need to have this nerve block performed. Monitoring during labor. Your healthcare provider will monitor not only the progression of your labor, but also the baby's heart rate. The heart rate can be monitored intermittently or continuously. Usually, if your labor is at low risk, the baby's heart rate can be assessed intermittently at regular intervals during and after contraction in order to predict any distress that might be present during labor. Continuous fetal monitoring using an external machine is used when the labor is at higher risk, such as attempting a vaginal delivery after a previous history of cesarean section, meconium-stained amniotic fluid, gestational diabetes, and other such conditions. However, if your labor is deemed to be low risk, this continuous monitoring does not appear to have a significant benefit over intermittent monitoring for you and your baby. Your healthcare provider will discuss both of these options with you to determine the most appropriate monitoring. It should be noted that even if your labor is deemed to be low risk, intermittent monitoring requires more frequent hands-on monitoring that may not be possible if the birthing unit is very busy with limited healthcare personnel. Interventions during labor. If indicated for protection against GBS infection, your healthcare provider will suggest giving penicillin intravenously every 4 hours to protect your infant. 4 hours of administration before delivery is required to reduce the small chance of infection affecting your baby. If less than 4 hours have passed before the beginning of administration and the baby's birth, then your baby might be at risk for GBS infection and will be monitored more closely after birth. This usually involves a blood test and monitoring of vital signs. If you had diabetes prior to your pregnancy or gestational diabetes, your sugar level will be closely monitored during the entirety of your labor and delivery and for a few hours after birth. If your pregnancy progresses for over 41 weeks, or you and your unborn baby are suffering from healthcare issues such as high blood pressure, fetal growth restriction, low levels of amniotic fluid, or etc., your healthcare professional may suggest an induction of labor. In this situation, the medical professional will give medications to cause contractions and ultimately result in birth. Before your provider provokes your labor, he or she will examine your cervix to determine whether the conditions are favorable to a vaginal delivery, and these include a soft, thin, and dilated cervix with the baby's head low in the pelvis. If the evaluating medical professional deems your cervix is not favorable, different preparations are available, such as medication or balloon dilation, to create a more favorable cervix. This aims to improve the conditions for vaginal delivery, thereby reducing the risk of a cesarean section. If your provider deems an induction of labor necessary, this means that the benefits of delivering the baby for you and your unborn child outweigh the risks of continuing the pregnancy. During the course of your labor, there may be instances where your labor and your contractions might slow down. Rupture of your membranes, otherwise known as breaking your water, might be an intervention used for speeding up the labor processes to have stronger and more frequent contractions. This is done with a small plastic device where the provider will scratch the sac surrounding the baby to create a small hole. The procedure itself is painless for you and for your baby, and the sac must break, of course, before your baby can be delivered. When the membranes are ruptured, amniotic fluid will leak throughout the rest of your labor and delivery. There's a small risk of cord prolapse where the cord comes out through the cervix before the head of the baby. This can also happen during labor unrelated to rupture of membranes by your provider. If this happens, this is an emergency condition, as the baby gets nutrients and oxygen through this cord, and a compressed cord can cut off oxygen to the baby. It will require an emergency cesarean section. Therefore, before attempting a rupture of membrane, healthcare professionals will make sure the head of the baby is sufficiently descended to perform this intervention safely and ensure the head of the baby stays well applied to the cervix during this process. Lastly, another intervention that may be used is an intravenous drip of oxytocin, which is a synthetic hormone that mirrors your own natural hormones. Oxytocin allows for an increase in frequency and strength of contractions. Labor process and stages. Once you are in more active labor, meaning regular contractions and a cervix of at least 4 to 5 centimeters, your cervix will progressively dilate and open faster to allow the baby's head to pass. Labor can progress very differently depending on the woman and her individual circumstances. Your cervix will gradually open until approximately 10 centimeters. At this point, it is fully dilated and you will soon be ready to push. When you're fully dilated, you may wait 1 to 2 hours for the baby's head to lower into the birth canal before pushing, as long as the baby's heart rate is fine and the baby's head continues to descend in the canal every hour. However, some women get a very strong urge to push. This feeling might be very similar to the need to pass stool, and it is 100% normal to pass stool at that time. Some women feel instinctively how to push, but others need coaching to push effectively. Different methods of pushing may be used, and women can choose the best option for them based on what feels good to them and is effective. Every delivery is different, and it is normal that a first birth may require several hours of pushing. This is completely normal. As a general rule, following the first vaginal birth, the second birth is usually quicker. Emergency procedures during labor and delivery. It is possible that your experience with labor and delivery might not happen as you planned. Your body's and/or your baby's reactions to labor might not be as anticipated. Sometimes, this can result in unexpected interventions in order to act in a fast and effective way to maintain the health and safety of you and your child. Emergency procedures require your consent and will be discussed with you. Sometimes, these procedures may need to be performed very quickly. Emergency procedures may include, but are not limited to, vacuum extraction, forceps delivery, or an episiotomy, which is a cut in the perineum to open more room for delivery, and these procedures are not routinely performed. It is also possible that you may require an unplanned cesarean section. Events may happen so quickly, you may not fully understand and process what happens. Do not hesitate to speak with your healthcare provider if this is causing you distress. It is sometimes a possibility that your baby might need hospitalization in the neonatal intensive care unit. This happens if the baby has difficulties after birth, such as difficulty breathing, or is born prematurely. This can be a stressful time, and you may be separated from your baby while you recover and the baby is taken care of. You'll be able to visit the baby often and monitor his or her progress. Immediate postpartum period. Immediately after the baby is born, if all is well with the baby, the umbilical cord will be cut by your partner or yourself. It is common for healthcare providers to wait 1 minute after the baby is born to cut the cord, called delayed cord clamping. Cord blood will be collected at this point if previously arranged with a private or public cord blood bank. Your baby will be stimulated to breathe, and your healthcare professional might remove secretions from the nose and mouth of the baby. Skin to skin with you and your baby is strongly encouraged after birth, as it promotes physiological stability in the newborn as well as initiation of breastfeeding. Skin to skin can also be performed with the partner or other family members and consists of placing the naked baby directly on the naked skin of the person. Skin to skin for 1 hour or more is recommended as it is linked to more effective breastfeeding. In general, it is recommended to start breastfeeding as soon as your baby shows signs of hunger, like rooting, sucking, stretching, etc. Your healthcare provider will assist you with breastfeeding if you wish. You will also receive either an intramuscular injection of oxytocin or an intravenous infusion of oxytocin in order to decrease your risks of heavy bleeding right after birth. The third stage of labor is the delivery of the placenta. The placenta is the organ that has been feeding the baby all these months. In some cultures and beliefs, the placenta can be used for multiple different functions. In certain circumstances, you may request to take your placenta home with you. This will need to be discussed with the healthcare team prior to delivery. After birth, you'll be monitored closely for significant heavy vaginal bleeding after your birth, also known as postpartum hemorrhage. There are many different medications or maneuvers done to decrease the risk and treat heavy vaginal bleeding. Other immediate postpartum interventions are administration of erythromycin to the newborn's eyes. This is an antibiotic ointment that is routinely given in order to prevent blindness secondary to infection. We also administer a vitamin K injection to the baby to prevent bleeding in the newborn, as it takes some time for vitamin K to be synthesized by the newborn gut. Lastly, the baby will also be weighed. Vaginal postpartum care. In some hospitals, you recover directly in the room you delivered in. This is not always the case depending on the facilities of your hospital. Some hospitals have a separate unit where the mom recovers with the baby. Most hospitals will encourage cohabitation with your partner, baby, and yourself. Your typical stay will be 24 to 36 hours. During your postpartum care, you'll be monitored for bleeding and any complications after birth. Your baby will also be regularly assessed for any issues. Hygiene care. You may experience some tearing in your perineal area, and this is common in the first vaginal birth. Your provider will stitch the torn area, and these stitches typically dissolve within a few weeks. Pain can occur in these stitched areas as it heals. Your nurse will help you with some pain management solutions. Some of these options include painkillers such as acetaminophen or Tylenol, ibuprofen or Advil, or naproxen. Lidocaine ointments are also available at the pharmacy and on most postpartum units and act as a local anesthetic to decrease pain. Some women may benefit from using cold compresses for the first 24 hours, followed by warm compresses thereafter. A sitz bath may also help relieve pain. Hemorrhoids may also bother you after lengthy pushing. Hemorrhoids can be treated with a hydrocortisone cream as well as witch hazel wipes. Change your sanitary pad every 4 hours and always wipe from front to back to prevent infections. We do not recommend vaginal douches. Bowel movement may be delayed in the first 2 to 3 days after delivery. Stool softeners are often prescribed for this reason. Eat high-fiber foods, drink plenty of fluids, and walking may help. If not, consult your healthcare professional for a laxative medication. Reasons to seek medical attention. Some reasons to seek medical attention after returning home include worsening of abdominal or pelvic pain, especially at rest, a new fever, or vaginal bleeding, filling up a pad in more than 1 to 2 hours. Thank you for your attention. Please refer to Chapter 7 for the life at home with your newborn.